Hi, and here we are back on week 3. Welcome back. Today I'm going to be focusing on chapter 4 in this PowerPoint. The review of chapters 1 through 3 will be in the beginning. I just want to go over a few things just to really reinforce some of the concepts we learned in our last class and through your text. Okay. In this PowerPoint, we're definitely going to focus on research problems, research questions, and hypotheses, and the different terms and definitions that are used within research. Okay. So last week we reviewed evidence-based practice. We've been doing that since week 1. It's so important that I felt like we should definitely talk about it again, just to really reinforce that everything you are reading about and focusing on and all the research you're doing is evidence-based practice. So remember, evidence-based practice is composed of clinical expertise, patient preferences and values, and best evidence, which helps to formulate clinical decisions, okay? And that's clinical decisions all across the board, whether it's within research, whether it's within your NCLEX exams, your APRN exams, all of that is based on evidence-based practice. What you're formulating when you develop your own research is going to help also contribute to evidence-based practice. So keep that in mind. We also reviewed different types of studies that are composed of quantitative data, which is numeric and you can count and measure, as opposed to qualitative data where you use your senses and to observe the results. Here's a great little video that I wanted to play for you guys to help just focus in and reinforce the differences between quantitative and qualitative. So if you just want to take a look at this.
Hello there everybody and welcome to the Mr. Sin channel. In this video, we're going to be going over qualitative and quantitative research. We're going to be talking about what both of these types of research are, how they're different, and also how they're similar. If this is your first time watching Mr. Sin video, welcome. Hopefully you find value in this video. If you do, please consider liking the video and subscribing. Also, make sure you take notes throughout the video. You can use your own notes or you can use mine. I have guided notes that I've created that go along with all my videos. You can find them in the description below. But this video is about qualitative and quantitative research. Now, they're both pretty similar, yet very different, and it's important to understand the differences between them. Qualitative research is going to be focusing on things that are up for discussion and for debate. It's going to be describing a lot of things. It will use surveys and observations and interviews, along with also looking at artifacts of an area. It'll look at language, it's going to look at religion and ethnicity, it's going to look at these things from a manner that is up for discussion. Where quantitative is going to be trying to definitively prove something. If a geographer, for example, is looking at an area, it's going to look at the economic data, the political description, it's going to look at population breakdowns through age and gender, or even looking also at things that are just concrete. These are things that are facts. You can't dispute them. They're not up for debate. When it comes actually to the research part, qualitative is going to be asking more questions that deal with what and how. They're going to be asking for more open-ended questions. For example, how do people living in inner city view their country? Or how do AP students celebrate finishing the AP Human Geography test? These questions aren't necessarily going to have a hypothesis because we're not trying to predict anything here. We're trying to gauge and understand better the society around us. Quantitative, on the other hand, is looking at research that is going to be looking at variables, and it's trying to either prove a hypothesis or possibly even disprove it. Here, questions are going to be asked a little bit differently. Questions are going to be focused around what, how, and does. So, for example, how much, how often, what is the relationship between the two? What is the percentage? An example question could even be something as simple as, what is the religious breakdown of the United States? Or, how often do farmers go to the market to sell produce if the road is paved or if it's unpaved? Or does public transportation actually solve transportation issues within a city? These are all things that would look at statistic and numbers to be able to answer these questions, where qualitative is more of an exploratory form of research, and it's not necessarily defining and trying to prove or disprove a hypothesis. When it comes to collecting data, qualitative is normally going to use one source to collect data from. Maybe it's newspapers, journals, it might be observations or interviews, or even audio and video materials. Now, with qualitative, they can change things up throughout the study if I notice they're not getting enough responses from one area. Quantitative, on the other hand, is just using numbers. They're looking for things to prove something right or wrong. So they're going to be looking for more statistics and things that are concrete. Lastly, when it comes to analysis and also the final report, qualitative is going to be set into themes. See, researchers are going to take all the observations, all the information they collected, and try to break it down into different themes. This is very time consuming. And the final report will have a lot of writing in it. It's going to have a lot of quotes and different things that they observed. And it will be up for discussion. The participants will be very involved in it. Where quantitative, on the other hand, is not going to have that many words. It's going to be taking, in the analysis portion, all the different data points that they collected. Then they're going to break it down to see if there's any statistical significance behind any of the information they gathered. Then they will have a final conclusion that'll either back up the hypothesis or go against it. The quantitative report is going to be a lot more rigid. It's not up for discussion or debate. It's just showing the findings of what they found. There's less interpretation there. And that's it. This video was a really quick overview of qualitative and quantitative research, but hopefully it helped you understand all the basics about these two different forms. Let me know in the comments below which one you think is more impactful, or when you think one form of research should be used over another, because they both have pros and cons to being used. Hopefully you enjoyed the video. I'm Mr. Sin. Don't forget to subscribe and check out some of the other videos on the channel. And until next time, I'll see you online.
So that's a great little recap on the differences between quantitative and qualitative. Again, quantitative deals with quantity, qualitative deals with observation. We also reviewed how to format our research question with the use of the PICO format, which is PICOT, the acronym Population, Intervention, Comparison, Outcome, and Timeframe. In class, we definitely did a few examples of how you would break down your research question with those 5 different components. Keep in mind, I want to just really reinforce that I intervention could also be exposure, such as in this question, what is the duration of a recovery outcome for patients with a total hip replacement population who developed a post-operative infection? That's not an intervention, that's actually an exposure, okay? But we just use the I within that box. Remember, comparison is not always in a PICO question, depends on the question. This one does have a comparison as opposed to those who did not. And then, of course, time. Within the first 6 weeks of recovery is the time here. And based on plugging in your information to your research topic within these 5 components, you can develop a well-built clinical question, okay? Next, we definitely talked about the hierarchy of evidence within a literature review. So when you do your literature reviews, you want to make sure that you're working more with studies that are at this level of evidence, okay? But down here is really the weakest level of evidence, and up at the top is where you find the most filtered, appraised, and accepted evidence-based practice. Okay, remember we went over the literature review of how to look through the CMSV library website to gather your articles. Remember, it's really important to track your search fields that you use when you're looking for your literature review. Okay, remember to write down and keep track of what search fields you're using, like what topic names you're looking under to find your articles, because you're going to need to reference that when you develop your chapter 2 in your second part of this class. All right, so just write down on a page of notes, you know, all the search fields you use to find your different literature reviews. Remember, the literature review research article should be no more than 5 years old. All right, we want new up-to-date data, and that is known as for 5 years or no more than 5 years old. In general, to develop your meta-analysis grid, you will need 10 to 12 articles. However, keep in mind that you're probably going to be reviewing at least 30 to 40 articles before you find and narrow it down to the 10 to 12, all right? It's going to take you a while to do this, so start it now, okay? You know your topic already, hopefully, so you don't have to know your question, but by now, I'm sure you've picked your topic. And at this point, you should be doing your literature review. Remember, you may not really know what question you want to ask. You know your topic, but based on narrowing down your articles and finding your literature reviews, then you can really develop a good, strong topic that will help improve nursing practice. Okay, and here we have the meta-analysis grid that we used. It's in your Canvas website. You can download it. It's a template you're going to use on Word. You're going to break down all 12 of your research articles into this grid and, you know, fill in the blanks. You know, fill out the authors, the conceptual framework, the design method, and through this, you will develop a great summary of all the articles and all the research you've done to formulate your own research. In class, we actually did a lit review on this particular article, Reducing Hospital-Acquired Pressure Injuries. That's what this analysis grid is broken down into, and it is up on Canvas, so you can download it if you needed another example. Today in class, we will be doing both of the articles you had for your discussion board. We will be reading and doing meta-analysis breakdown of them, so you can get more practice. Here is a great little video on how to search for relevant literature based on your topic. Now, this particular girl is not searching for research-based stuff, but her methodology is exactly how you should be thinking. And she does a great little example of how she's doing her
Welcome
search.
back, subscribers. Are you ready to start your literature review? Let's zoom in on the first step of writing a good literature review. You need to search for relevant literature. If you don't know what a literature review is, check out this video first. Okay, so obviously you're searching for literature related to your topic. Start with creating a list of keywords on your topic. For example, our topic is social media's impact on the younger generation's body image. So our list of keywords could be mental health, body image, teenager, social media, Facebook, Instagram. Once you've had that list of keywords ready, go to your favorite database. It could be your university's library catalog, PubMed, ScienceDirect, or Google Scholar, which is what we will be using in this video. Now, who doesn't know how to type in their keywords and hit enter? That's for amateurs. I'm about to show you 2 more tricks to instantly narrow down your search and find much more relevant papers. For the first trick, you should first think and write down all the synonyms or subtopics of the keywords you've searched for. In our case, Gen Z, younger generations, and teenagers all represent the age group we're looking for.
It's 10
and here's
o'clock.
a pro tip. Use these things called Boolean operators to help us refine the search. You can use these in all different databases. You use and, so all the keywords have to be included in the results and not just part of the search. Use or to search for either of the synonyms. And for terms you don't want in your results, for example, if you're searching for the fruit apple and not the tech giant, we can use the minus sign to exclude technology, iPhone, Mac, etc. You can also use double quotation marks to search for results with exact matches. So in this case, for body image and social media. Once you've found a source you think might be useful, make sure to read the abstract before diving in headfirst. You get a glimpse of what the research is about and know if it's relevant to your topic. And when you've found a source that's relevant, check its bibliography and look for source titles that seem related to your topic. Often you'll be able to dig up some gems. To identify the most important publications on your topic, take note of recurring citations. If the same authors, books, or articles keep appearing in your reading, make sure to seek them out. You can also look at how many times the article has been cited on Google Scholar. If the number is high, the article is probably influential in the field. Then you should definitely include it in your literature review. Keep digging and reading, and when you're done, watch this video on how to identify themes, debates, and gaps. I'll see you there.
So those are helpful tips on how to do a good literature search. Okay. So one of the things we definitely also should make sure you remember, and hopefully you've read about in your text, is variables, okay? This is used more in quantitative research, and variables are obviously something that vary, okay? Examples include weight, fatigue, and anxiety. Each one of those vary from one person to another. Quantitative research uses variables to seek to understand how and why things vary and to determine if differences in one variable are related to differences in another. Okay, so when you're looking at variables, you want to think that the dependent variable is the outcome, the O in PICO, and the variable is the behavior characteristic the researcher is interested in explaining, predicting, or affecting. Okay, so the independent variable is presumed the cause of or influence on the dependent variable. You can think of independent and dependent variables in terms of cause and effect. where an independent variable is the variable you think is the cause, while a dependent variable is the effect. Okay, and the thing that's important about knowing and understanding the two different variables is when you are discussing your research and your topics and how one thing influenced another within your research, you're going to have to describe it in terms of the different variables, and you're going to have to define the variables, especially when we get into chapter 2 on the second part of the class. Okay, so all these different terms we're using for research is getting, I know, a little overwhelming and slightly confusing. So one of the things we have to really differentiate is the topic, the research topic versus a research question. Okay, now that being said, all of them sort of are intermingled and kind of are almost reworded differently, but you have to understand why each one is broken down the way it is so that you can specifically and very clearly detail in a detailed manner, say what your research is about and why you're doing it and why it's relevant and important to nursing. Okay, so here's a great little video on differentiating the research topic versus the research question.
Understanding the difference between a research topic and research question. In research, the emphasis is on generating a unique question and then synthesizing diverse sources into a coherent essay that supports your argument about the topic. In other words, you integrate information from publications with your own thoughts in order to formulate an argument. Your topic is your starting place. From here, you will develop an engaging research question. A research topic is broad, neutral, objective that is factual, and open-ended. Let's go into more depth. Research topics are broad in that they discuss an overarching idea like how can I prevent injuries? They are neutral in that they do not take a position. For example, how does one implement injury prevention? They are objective because they will often lead to minimal data, but not necessarily improve an argument. For example, how much time do athletic trainers spend on injury prevention? Finally, research topics often discuss an open-ended idea like does injury prevention work? A research question, on the other hand, is narrow, takes a position, subjective, is an issue you can take sides on, and gives direction to research. A research question tackles a narrower scope. For example, how can I prevent lateral ankle sprains in female college volleyball players? They often take a position like are athletic trainers more likely to implement an injury prevention program if they are provided with injury reduction bonuses? They are often subjective. For example, does one's work setting affect time spent on injury prevention? Finally, RQs give direction to research such as does injury prevention improve patient satisfaction? Before we can have a research question, we must have a research topic. The critical step between a research topic and a research question is an understanding of the current literature which exists in your research topic area. I guess it's time to get reading.
And this is a really important point I wanted to point out. We're getting a lot of emails from the students, which is great. You guys are emailing topics, and how does it sound, and what do we think about it? But I want you to keep in mind, the topics are up to you. That's your decision, whether we like it or not. If it's what interests you, which is what is important to us. More importantly is, what is your actual question? What are you going to do with this topic? And that I can't answer for you, and neither can Professor Alana. What you have to do is take your topic and start your literature review, because that will help you narrow down what exactly you're going to research. That is the whole reason that we've been trying to encourage you and educate you on how to do the literature review. That is really where you're going to get your question from. Once you take the information that you want to figure out, you plug it into your PICO format and you develop your question, okay? Remember, a topic is very broad. The question narrows it down to what you're actually going to research. Now, defining the terms related to research. So again, as a review, a research problem is a troubling condition. Identify a research problem within a topic of interest. So you have your research topic, which is very broad, and then the research problem, which really hones in on what's the problem? Like, what exactly are we looking for here? The purpose of research is to solve the problem or contribute to its solution by generating relevant evidence. Now, again, when you develop your research problem or your research question, you're really trying to figure out something that's actually going to make a difference. It's not just an observation and gathering data. What is this data going to do to improve nursing practice? Really ask yourself that when you develop your question, okay? How am I contributing here? What good is this going to do? Researchers articulate the problem in a problem statement. Research questions are the specific queries research want to answer in addressing the problem. Researchers who make predictions about answers to the research questions pose hypotheses that can be tested, and that's more in your quantitative studies, okay? Because the hypothesis is proven by the numerical, measurable data, okay? Many reports include a statement of purpose, which summarizes the study goals. Okay, now how do we break down each one of these and differentiate them? Let's look at the definitions of each one. So the problem statement articulates the nature, context, and significance of a problem. It includes components to form an argument for a new study. Problem identifies the background, the scope and consequences of the problem, knowledge gaps, and possible solutions to the problem. The statement of purpose summarizes the overall study goal, identifies key concepts and variables, and the population. And it communicates the underlying research tradition of qualitative studies or whether the study is an experimental or non-experimental in quantitative. The research question, coming back to PICO, is the specific query researchers want to answer in addressing the research problem. Now keep in mind, these are all very similar when you actually read them on paper, but they're worded differently, okay? And some have more details than others. Hypothesis, as in quantitative studies, is a statement of a predicted relationship between two or more variables. You have your different types of hypothesis, which you're going to differentiate based on your own research. And keep in mind, in some cases, hypotheses, actually in most cases, hypotheses are never proved or disproved. It's not that they're proved or disproved, it's what your hypothesis is proven by based on the most adequate evidence-based practice data. Okay, so whether the evidence-based practice data either supports it or it does not. And how does it support it? Well, it either has a lot of evidence-based data or it doesn't. And based on that is how you develop your either approved or disapproved hypothesis. Okay, so examples of terms relating to research problems. So here we go. So what's our topic? Side effects of chemo. Okay, what's our problem, our research problem? Okay, what are we finding as a problem? And why is this topic important to us? Because this is the problem we see about this topic. So we're looking at side effects of chemo, and the problem we're seeing is that nausea and vomiting are common side effects among patients on chemo, and interventions to date have only moderately been successful in reducing these side effects. One issue concerns the efficacy of alternative means of administering antiemetic therapies. Okay, so they're honing in on their problem. What's the problem? Nausea and vomiting is an issue. We really haven't honed down on how to handle these side effects. And one of the biggest concerns that this study is going to focus on is alternative means of administering the medication. How are we going to give these antiemetics so they actually can work better? All right, let's see. What's our statement of purpose here? The purpose of the study is to test an intervention to reduce chemotherapy-induced side effects, specifically to compare the effectiveness of a patient-controlled and nurse-administered antiemetic therapy for controlling nausea and vomiting in patients on chemo. Okay, so they want to see the difference. What's the difference here? If the patient gives it to themselves versus the nurse giving it to them, which one is going to have more effect on the patient? So if the patient takes the antiemetic therapy themselves versus the nurse coming around and handing them the medicine, how are they going to have better control over their nausea and vomiting? Let's see. So what's our research question? What are they actually formulating the question based on the purpose of this? Okay, what is the relative effectiveness of patient-controlled antiemetic therapy versus nurse-controlled antiemetic therapy with regard to 1, medication consumption, 2, control of nausea and vomiting in patients on chemotherapy? Okay, so what do we think is going to happen in this study? Let's hypothesize that. The hypothesis is patients receiving antiemetic therapy by patient-controlled pump will, 1, be less nauseous, 2, vomit less, and 3, consume less medication than patients receiving the therapy by nurse administration. Now, if you had not read that hypothesis, the likelihood is you probably would have guessed that, yeah, if the patient administers the medicine to themselves more proactively than waiting for a nurse to come around and do it, the likelihood is, yeah, they probably will have better control. But wording it in the more scientific, research-based, evidence-based way, we formulated a beautiful hypothesis to say that with an educated guess, this is what we think is going to be the result of our research. Okay, so this is the different way of wording your research topic versus your research problem versus the statement of purpose, like why you're doing this study, versus what your actual study is within the research question, and the hypothesis, what you think is going to happen. Okay, so this is what I want you to keep in mind when you're selecting a research problem. Number 1, you guys have been emailing us, different topics. Great. We don't want topics. We want to narrow it down to a PICO question, right? So here's what you need to consider when you're formulating your PICO question, because keep in mind, this is a study you're actually going to have to put into place. So what's the significance of the problem? How is your question and your research actually going to contribute to practice? Is it a problem that it's important to nursing and its clients? Okay, is it going to actually benefit the patient? Is patient care going to improve because of this research you're doing? Will the findings challenge or lend support to existing practices? Okay, so remember, is your problem significant enough that it's worth all this time doing all this research? Okay, researchability of the problem. Realize that not all problems are amenable to research questions or research inquiry, because a lot of things that we want to research are just moral or ethical in nature. For example, should assisted suicide be legalized? Okay, there's no right or wrong answer there. That's just a point of view. You're just looking at people's different points of view. So if we wanted that topic still, even though we want to hone in more and actually get some information for this particular topic, if you're passionate about it, this is a different way you could pose the question. What are terminally ill patients' attitudes towards assisted suicide, which would be more useful in developing a better understanding of the issue? And, with that information, how is that useful? Well, we could present that to, ethical committees when they're not sure about if this is something that they think is good or bad. Well, why don't we talk to the patients who are actually going through it so we can provide them with the data and the evidence of how they feel in their most desperate time of need about this subject. Okay, feasibility of the problem. All right, so these are the different components that you have to look at in the problem that you're actually researching. So will you have enough time to research it? You want to kind of estimate how much time your study is actually going to take, because we're limited here, obviously. We're in a class, we got to graduate. So how much time is your study going to take? And remember, you might want to overestimate, because a lot of the times the things you have to do may take you more time than you actually think more time than they actually will, okay? Researcher experience. So definitely pick a topic that you have a little foundation of already experience with, because if you're picking something you know nothing about, it's going to be really hard. And you don't want to put that much pressure on yourself, especially when you're already looking for new information of things you're going to have to gather. Okay, availability of study participants. Consider whether the patients with the desired characteristics will be available and willing to participate. Sometimes it takes considerable effort into recruiting participants. And I know that's so true, because if if you're part of any kind of nursing association, you're getting a lot of emails on a daily basis to participate in studies, surveys, questionnaires. It's a lot of work, to be honest with you. A lot of the times I don't even bother reading it. I don't have time. But sometimes these surveyors or these research people that are sending this stuff out actually give you an incentive. Like, if you fill out my research thing, I will give you a $5 Amazon gift card. Ooh, that sounds like a little more of a reason to do this. You know what I mean? It's not even just about something tangible. You could just really present your survey, your questionnaire, whatever it is you want the participant to participate in, with the preface that, hey, you could really help a lot of people by helping me, develop this information or this research project. So just make sure, you're going to have availability and people who are actually willing to do the studies. Okay, and that goes back to cooperation of others. Same thing. Are you going to have access to records? Are you going to have access to the clients within your facility? We've already gotten an email that, one of the students here wants to do something on her floor, but she just realized like she's really limited on access to certain things that she thought she was going to have access to. Understandable. HIPAA is a real thing, confidentiality is a real thing, and facilities have, their own protocols as to what they're allowing to be available, and it's understandable. But what you have to do is really try to figure out what you do have available to you and try to work with that. Okay, and then if you need to, be creative, think outside of the box. Is there a tool that you can develop to gather your own data that you'd be allowed to use? Really try to think about different avenues of how to get your research. And if you find that you keep coming again on roadblocks to get the information you need, perhaps you need to consider doing it outside of your facility. Facilities and equipment, consider what facilities and equipment will be needed and if they will be available. And of course, money. Money is a big deal, okay? How much is it going to cost? Are you going to pay your participants to participate? You're going to need supplies. You're going to need, if you're doing surveys or questionnaires, you're going to have to print all this stuff. Are you going to be able to afford that? Who's going to pay for it? Can you get it done free at the library? Are you entitled to a certain amount of printing from CMSV? Like, these are things you're going to want to think about because it does cost money. And of course, and most important, research interest. Definitely, like we had said in the very beginning, you want to research a problem that is really something important to you because you're spending a lot of time reading it. So you want to really put a good effort with some passion behind it. Okay, problem statement and hypothesis. So here's a great little video on how to develop a problem statement and how to apply a hypothesis to it as well.
Hello, everyone. In the previous lesson, we discussed an overview of the scientific method. In this lesson, and actually in the next few lessons, we will discuss the scientific method in a greater detail. In this video, we will focus on writing the problem statement and hypothesis. Let's begin by defining the problem statement. A problem statement is a description of an issue that needs to be addressed. It provides the context of the research and contains the purpose of the experiment. Let's take the example that we used in our previous video. If you haven't seen it, I'll provide a link in the description box below. We wanted to find out which among the three citrus fruits, lemon, orange, and lime, has the highest content of vitamin C. This is where we will be obtaining our problem statement. But before we can write a problem statement, we have to identify our variables. Variables are elements that vary or change within a study. There are three kinds of variables: independent, dependent, and controlled. The independent variable is the one being manipulated in the study, while the dependent variable is the one that responds to the changes in the independent variable. Going back to our example, our independent variable is the type of citrus fruit, while our dependent variable is the amount of vitamin C. Controlled variables are the ones that are kept constant in the experiment to avoid other factors to affect the dependent variable. When experimenting on the amount of vitamin C on our selected citrus fruits, we keep some elements constant, like temperature of the room, maturity of the fruit, amount of indophenol solution to be used, among others. Our problem statement then could be written as: the purpose of this study is to identify which among lemon, orange, and lime has the highest amount of vitamin C. Notice also that we use the scientific names of the fruits to be very specific. Here are some more examples. The purpose of this study is to identify the effect of adding salt on the boiling point of water, where the independent variable is presence of salt and the dependent variable is the boiling point of water. Another example is, the study aims to identify the effect of different amounts of salt on the boiling point of water. The independent variable here is the different amounts of salt, and the dependent variable is still the boiling point of water. Notice that the two experiments are almost the same, but not quite. The difference in the independent variables will call for a different kind of experiment. Note that it is also very important to emphasize words such as presence, amount, or concentration in your variables. Hypothesis, on the other hand, as how we defined it in our last video, is a temporary answer or solution to our problem statement. Important reminder, hypothesis is not a wise guess. The hypothesis that we formulate is based on prior research, meaning we have a basis. So technically, we are not guessing. There are three kinds of hypotheses that we will be tackling in this lesson: null, alternative, and cause and effect. Null hypothesis states that the variable has a significant effect on the dependent variable. For example, the presence of salt has a significant effect on the boiling point of water. Last is the cause and effect hypothesis. It states that a certain manipulation in the independent variable will create a specific change in the dependent variable. For example, if the presence of salt has a significant effect on the boiling point of water, then adding salt will also increase the boiling point of water. Another important reminder, we choose the appropriate hypothesis for our research depending on our variables and mainly the goal of our study. To recap, let's practice by taking a look at this example problem. You may pause the video if you need more time to read and answer. Did you get the answers correctly? If yes, congratulations. If not, well, practice makes perfect. Did you like this video?
Okay, great. Now the next thing I really want to do is focusing on developing your research question. Now again, this is going to be a recap of PICO and how you come up with the different components of your research question.
In this video, we'll be looking at research questions. We'll look at what a research question is, why you'd want to have one, how to create one and check to be sure it's good, and what you do with it once you have one. First, what's a research question? A research question is an actual question you ask yourself about your topic. It's some aspect of the topic that you're interested in and want to find out more about. All good academic research starts with a research question. The research question doesn't usually show up in the final paper, but we can see evidence that there was one. In this article, the authors state the goal of their article: to assess the factors that make people willing to pirate digital music. They don't tell us what their research question was, but based on their goal, we can assume they had one, and it was something like, why do consumers pirate digital music? You'll almost never be asked specifically to create a research question as part of a research paper, but you should always start with one anyway. Now that you know what a research question is, why do you need one? Most students find a topic, then start working on their research paper. Let's assume your topic is the number of women in politics. A topic is a starting point for a research question. You ask a research question about a topic. On our topic, we could ask the research question, why do some countries have more women politicians than others? There are lots of possible questions you could ask about any topic. For example, we could also ask, does having more women politicians lead to better laws for women? Picking a question helps you focus and gives you an angle to approach your topic. This helps you streamline your research and writing, which will save you a lot of time and make your papers better. Next, we'll look at how to create a research question. We'll follow some steps. First, pick a topic you're interested in. Then find one aspect of the topic you want to focus on. Think of some questions you could ask about that aspect of the topic. Pick one, then focus it to be sure it's a good question. We'll go through these steps using our example. First, pick a topic you're interested in, like women in politics. Next, think of different aspects of the topic you could focus on. Here I've made a concept map of some of the different aspects of the topic women in politics. One might be women voters, how they vote, and whether they vote for women politicians. Another might be women politicians, differences from male politicians, how many there are, and what affects that. Once you've thought about what aspects of the topic there are, pick one of them to focus on. Let's pick numbers of women politicians and what affects that. Now try to think of some questions you could ask about the aspect of your topic that you've chosen. On our topic, we could ask things like, why do some countries have more women politicians than others? Or, what kinds of barriers hinder women who are entering politics? Once you've thought of some questions, pick one to work with. Let's pick, why do some countries have more women politicians than others? Finally, look at your question to be sure it's specific and clear. Make sure your question is clear about who, what, where, and when you're talking about. Let's see how we can make our question more specific. We don't want to know about women politicians at all levels of government, so we'll specify the national level only. Some countries is also quite vague. We should focus on some specific countries to compare, like Canada and Sweden. In this case, our more specific question would be, why does Sweden have more women politicians at the national level than Canada? Now you know how to create a research question. But how do you know if it's a good question? A good question focuses on only one issue and doesn't try to fit in too much. It requires analysis and thinking and doesn't have an obvious yes or no answer. How and why questions are best for this. A good question is specific and focused and can be answered in the space you have to write about it. The shorter your paper, the more specific your question needs to be. A good question is also clear, with all the vague words, like some countries, defined or made more specific. Let's look at this question. How does the media represent Islam? It's focused on one issue, which is good and requires some analysis. But it's not a good question because it's not specific enough. It should be clear who, what, where, and when it's talking about. For example, media could be newspapers, TV, music, videos, or advertising. It could be media in Canada, South America, or India. Islam could mean the religion, some aspect of the religion, or people who are Muslim. A better question would be, how have newspapers in the US represented Muslim women since 9/11? You don't usually put your question into your final paper, so what do you do with it? Basically, you do research to find the answer to your question. Having a research question helps you focus your research, since you're looking for information that helps you answer your question. For our question on why Sweden has more women politicians than Canada, we might need some statistics to tell us whether that's actually true. We'd also need to know the reason Sweden has a lot of women politicians. Then we'd need to know what's different in Canada. Knowing what information we need to answer our question helps make the research more efficient. We know what kinds of sources we need and what we're looking for in those sources. Your research question also helps you create your thesis. Your thesis is the answer to your question summarized in one sentence. For example, our thesis might be, Sweden's electoral system encourages the participation of women in politics better than Canada's. The rest of your paper would support the thesis with more detailed arguments. Your whole paper will focus on answering your research question, which helps give structure and focus to your paper. Try it yourself. Create a research question using the steps we discussed. Pick a topic, narrow it, brainstorm some possible questions, then pick one and make sure it's clear, focused, and specific.
So that's a great review on how to develop a research question. Using the concept map to help you narrow down what exactly you're looking for is also a really good tool. Okay, so here's the guidelines for critiquing research problems, research questions, and hypotheses. This is the guidelines used over when you did your discussion question this week. It's right in your text, it's right in the table in chapter 4, but I really would encourage you to look at these questions specifically when you're looking at your own research problem. What is the problem? Is it relevant to nursing? Is it going to help build, have a significance for nursing? And evidence-based practice? Will it contribute in terms of education or policy or making a change to help improve people's lives? Make your research something that's actually worth doing. Is there a good fit between the research problem and the paradigm in which the research was conducted? Is there a good fit between the problem and the qualitative research tradition, if applicable? Does the report formally present a statement of purpose, research question, and hypothesis? When you formulate your purpose and your research question and your hypothesis, you're really showing the readers why this study is actually important and how you're going to, think about it, how we should all think about it. Are purpose statements or questions worded appropriately? For example, key concepts and variables are identified, and is the population of interest specified? Use specification and details as to who you're looking at and why you're looking at them. Are the verbs used appropriately to suggest the nature of inquiry or the research tradition? Okay. If you don't have a formal hypothesis, is the absence justified? Are statistical tests used in analyzing the data despite the absence of a stated hypothesis? Do hypotheses, if any, flow from a theory or previous research? Is there a justifiable basis for the predictions? So basically that's saying, are you guessing your hypothesis, or did you come up with this hypothesis based on prior evidence-based practice? Is the hypothesis properly worded? Do they state a predicted relationship between two or more variables? So these are things that you're thinking about. You may not have to formulate right away, but keep in mind at some point with this research you're doing, you will have to formulate it specifically in chapter 2, which is part 2 of this class. All right, but you need to already have the thought process of how all of this is going to flow based on what you're doing now. All right, thank you. And now we're going to break into groups to do another examples of meta-analysis based on the articles you read from your discussion questions.